Hi, guys. Welcome back for our daily practice questions. It is day 158 and our Pharm series continues. But as always, y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you're looking to gain access to my MP Test Success Toolkit, it is free and linked in the description. Also, y'all know my website is up and live and updated, and it's linked in the description as well. And it helps you to navigate through all of the resources based off of what you need. So if you're a first time test taker, there's a section that shows you the resources that are best for you. And then if you are retesting, there is a section for you as well. All right, you guys, let's get into question number one. Question number one states a 42-year-old patient is diagnosed with H. pylori after a positive urea breath test. They have no known drug allergies. What is the recommended first line treatment regimen? Is it A, a PPI plus amoxicillin plus some metronidazole for 7 days? Is it B, a PPI plus clarithromycin plus amoxicillin plus metronidazole for 14 days? Is it C, a PPI plus bismuth plus tetracycline plus metronidazole for 10 to 14 days? Or is it D, a PPI plus clarithromycin plus amoxicillin for 10 to 14 days? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the recommended first line treatment regimen? All right, so I tell y'all, if they're looking for a treatment, you need to run it back and see if a diagnosis has been provided to you. It has in this scenario, but in the event that it has not, you got to run it back a step further and look at those assessment findings because you got to know what it is to be able to treat it, right? So here, this patient is diagnosed with H. pylori, and then we're looking for a first-line treatment regimen. Now it says that there's no known allergies, there's no other contraindications stopping us from doing any of the standard treatments for H. pylori. So your best answer is D, your PPI plus your clarithromycin plus your amoxicillin for 10 to 14 days. Remember that we do our triple therapy or quadruple therapy for your H. pylori management. And typically we go with that triple therapy first line because hey, who wouldn't want to take a three medication treatment option versus a four medication treatment option? So it is found to have more compliance. Um, unless there's contraindications. Okay. So again, I always call it like CAP so you can remember it: clarithromycin, C, A, amoxicillin, and then the P for PPI. Okay. So again, your best answer is D. Question number two. A 35-year-old patient is diagnosed with H. pylori and reports a history of anaphylaxis to penicillin. What is the most appropriate treatment regimen? Is it A, a PPI plus amoxicillin plus clarithromycin? Is it B, a PPI plus clarithromycin plus metronidazole? Is it C, a PPI plus amoxicillin plus metronidazole? Or is it D, a PPI plus bismuth plus a tetracycline plus metronidazole? Take a moment and tell me what you got. All right, you guys. So, stem of the question here states, what is the most appropriate treatment regimen? So, again, they're looking for a treatment. So, we need to run it back and look and see if a diagnosis has been provided. And it has. Again, this patient has been diagnosed with H. pylori. But the key right here is the patient has a history of anaphylaxis to penicillin. So, they're looking for the most appropriate treatment. First line, we'll typically go with that triple therapy, but remember that triple therapy with your CAP, clarithromycin, amoxicillin, and PPI, has penicillin included, right? Your amoxicillin, right? So this is when that quadruple therapy is a better option. So D is your best answer, okay? And then lastly, question number 3, a patient completed 14 days of the clarithromycin-based triple therapy for H. pylori, but a urea breath test 6 weeks later is still positive. They were adherent to the medications. What is the most appropriate next step? Is it A, to repeat the same regimen for a longer duration? Is it B, to begin bismuth quadruple therapy for 14 days? Is it C, prescribe a PPI for symptom relief and monitor? Or is it D, to refer to gastroenterology for endoscopy? Take a moment and tell me what you got, y'all. All right, all right, all right. So, stem of the question, what is the most appropriate next step? So, again, if they are asking for a treatment, we got to run it back and see if we have a diagnosis. And we do. Again, we're treating H. pylori. But in this scenario, the patient has completed their 14 days of the triple therapy clarithromycin based regimen, right? But when we do the follow up with the urea breath test 6 weeks later, it's still positive. So that's telling you that it did not work, right? Although they were adherent, they were compliant with the medication orders and prescription, but they're still having this positive test. What would you do in the event of that? So then you would go with B, right? You're going to begin that quadruple therapy. If the triple therapy has not been successful, you go to the quadruple therapy. So when I want you to think of H. pylori, one, when you're thinking about treatments, and this is why I'm doing my Pharm series for you guys, when you're thinking about it, I want you to classify these in your triple therapy and then in your quadruple therapy. First, understanding what falls into those, right? And for the triple therapy, remember Brittany's Brilliance, CAP, clarithromycin, amoxicillin, and a PPI, right? Remember that we typically would go with our triple therapy as first line therapy because it's more of people are typically more compliant, right? Because you have less medications. Think about taking 3 and 4 pills for 10 to 14 days. It's a lot. So um, typically we just go with the triple therapy unless there are scenarios like question number 2 where they have an allergy and it's contraindicated, or if there's resistance noted, like they've been on a macrolide or have some type of allergy to macrolides. Because remember, clarithromycin, myosin ending is a macrolide. Then we will steer clear of that. So, and when I say like there's a resistance, think about azithromycin, your Z-Paks that are commonly used for a lot of respiratory things and sometimes overused or misused, right? And so we start to have a lot of resistance in some states and areas. So if that is a case, that's a reason why we would not go with the triple therapy as well. Then you would utilize your quadruple therapy, right? Or in scenarios like this question right here, if we have utilized the triple therapy, completed it, the patient has been compliant and adhered to the prescription, then and they still have this positive finding, then you're going to move to the quadruple therapy. So I wanted to provide you all scenarios so that you know how to approach this. But y'all know we're keeping through this Pharm series because I want to make sure that you are successful from all standpoints. So knowing the knowledge and applying the knowledge, right? But as always, y'all, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel, as well as if you just go directly to the website link, it'll navigate you through all of the resources and guide you through what best fits your testing scenario. But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.